Okay, so with the ACA, which is the Affordable Care Act, there are a lot of, nuts and bolts in this thing, and I'm going to try to simplify this. I'm going to go over basically all the details of what it means. For example, it means guaranteed coverage for individuals, no matter your income. It also brought down the costs for your monthly premiums. There's no annual limits on these policies now. Prior, there used to be sometimes a 2 million or 4 million limit on the policy, meaning if you had heavy-duty brain surgery or something, or cancer of a really bad case, or a bad car wreck and you need reconstructive surgery, the policy could be exhausted. That means you hit the 2 million or $4 million mark of expenses, then the health insurance company would say, we're done, we've exhausted the limits, good luck, time to find a charity or something to help you, because they would what they call exhaust the limits of the policy. So now there are no limits, and there's also no denial of coverage in case you have a pre-existing condition, be it cancer, diabetes, you name it. Everything is covered now if you're a live breathing person. Rates are not based upon health status. So let's say you do have diabetes and you want health insurance. The health insurance carrier cannot say, yes, we'll take you, or no, we will not take you, or, oh, you have diabetes, so now your rates are going to be more than if you are a 100% healthy individual. This new law requires larger employers to it requires them to offer coverage for their employees. Now, 1 to 50 employees is a different subject, and that is subject to a penalty. If you do not have a group health plan for your employees, then you can pay, I believe it's around $5,000 penalty every year for each person that you do not offer health insurance for. The affordable coverage, public or private, is required for individuals now. So as you've heard, there is a fine. So whenever you do your taxes, they'll ask you if you have been covered. Well, they'll ask you affordable coverage, public or private, required for individuals. So when you do your taxes, they're going to ask you if you have coverage or not. So if you do not, then last year there was a penalty, I think $95 fee. This year's $300 or $400. I'll have those facts. I'll pull those up for you so we have the facts. Now, the 10 essential health benefits that the Affordable Care Act actually does offer, for example, 1, ambulatory patient services. So if you get injured and you need to take an ambulance ride to the hospital, that will be covered. Emergency services. So you get to the emergency room is going to be covered as well. This is across the board. So any health insurance company that's doing business in California, for that, or across the country, because this is nationwide, they have to abide by these 10 essential healthcare coverages. So they have to have these. Again, ambulatory services, so if you're riding in the ambulance, emergency room care, hospitalization, so if you do indeed have to be checked into the hospital, that will be covered. Maternity and newborn, obviously if you have a child, you will have coverage in the hospital for delivery services. And the child will automatically have coverage as well. Usually it'll follow the mother's health plan until the child gets its own, which will be around 60 days. If that type of situation affects you, just ask me. I can get the details for you. Sometimes I don't know every single answer, but I am very resourceful and I have access to a wealth of knowledge and resources. So you just let me know. Moving on. Number 4, mental health and substance use disorder services, including behavioral health treatment. So that could even include rehab services, psychiatric care, counselors, psychologists. That's going to be covered. You have prescription drugs. That's going to be covered as well. If you need prescription drugs, you will have coverage for it underneath these new essential health care benefits. rehabilitative and habilitative service and devices. So in case you need extra services, rehab services, say you break your arm, now that the doctor prescribes rehab, you can get that too. Lab services, simple enough. You go get your blood checked. That's going to be covered as well, to test your blood, things of that nature. Preventative and wellness services and chronic disease management. So if you have a chronic disease, these healthcare essential benefits will give you coverage to get you back to normal as possible. And preventative care, that's one of the things. So you get your annual checkup, that's going to be covered. They have realized through studies that if you just get one checkup a year and you take care of yourself in regards to a good relationship with the doctor and they're checking your vitals, then the healthcare costs overall will be lower, because you're not letting yourself go over, that's where a lot of extra healthcare costs get. People never get checked up, therefore the expense is greater than if they would just get normal checkups throughout every year. Pediatric services, of course, that's for the children. So the kids are going to be covered. Obviously, we're talking about a lot of adult things here. Kids are covered as well. So those are the improvements in overall coverage for the healthcare industry. My opinion, I think it's a good thing, because it was kind of loosey-goosey before and just kind of old Wild West. Everyone let the boys be boys, insurance companies play ball. However, it's not always fair. My opinion doesn't really matter. I'm here to help you. If you need to be enrolled in a plan, please contact me. I will have my information pop up on the screen. Moving on. Who is eligible? Every legal California resident is eligible. Now, who's not eligible would be the undocumented immigrants. So once the immigrants get a green card or whatever it may be, I can help you then. We have also, if you're incarcerated, if you're in prison watching this video, I can't help you until you get out. Moving on. The basic vision for this whole plan is to improve the health of all Californians. This goes back to the whole, preventative care and doctor checkups. If everyone was just to get checked up by a doctor and have a primary care physician that they have a relationship with, their overall health is going to be better, as opposed to just disregarding any kind of checkups, or that whole opinion of, I don't like doctors, so I'm not going to go see one. Just get the checkup. Access to affordable care. That is the vision of this whole plan. To give individuals access, which is what a lot of people did not have when, in regards to not being able to afford it, or they didn't have access to a plan because of a pre-existing condition. So, and then basically just to provide quality care, I look at it like this is a step up for humanity, and that's my opinion again, for whatever that's worth. The mission overall for Covered California is to increase insured Californians. It's also to improve healthcare quality. It's also to lower the costs, like I was saying earlier about, in those cases, people let themselves go so far that the expenses get so extreme that it would have been cheaper if they'd have just checked up with a doctor year by year. So that's kind of a paradigm shift for some people. Overall, just to lower these healthcare costs, reduce health disparities, and to give you a little bit more choice. So when you do enroll, when you contact me and I enroll you, depending on your income level, we'll either enroll you in Medi-Cal, or we're going to enroll you in an individual plan with a carrier. You've heard of them, some of the main players out there. We'll get into that later. Now, the way Covered California works is it's operated by the state of California. The State Health Exchange was formed under the Affordable Care Act. It was actually the first state health exchange. Not every state in the country actually made an exchange. Therefore, they're mandated by healthcare.gov. So you've probably all heard about that website. It had a lot of issues getting off the ground. Basically, I think it was a bottleneck issue. It wasn't built big enough for all of the people going to it. Now those kinks have pretty much been ironed out. So let's see here. It's a .com, as you know, coveredcalifornia.com, but it's state ran. So it should probably be a .gov, but whatever. Name brand health insurance policies. So obviously, like I was saying, the names, they're all out there. All the main names that you've heard of that are going to participate in California for healthcare insurance, we will have an option depending on geographically where you are in the state. Northern, around San Francisco, Bay Area, some of those participating carriers won't participate down around Los Angeles. And San Diego as well. So depending on where you are, and I can help you all over the state. So statewide, just let me know. Now there is this, what they call SHOP. That's for Small Business Health Options Program. So if you have a company, I can help you with the group health as well. There's different determining factors. If you're 1 to 50 employees, that puts you in one bracket. 50 to 150 employees or to 200, that's a different category. I can help you across the board, no problem. A lot of insurance brokers out there are going to be familiar, but as I've noticed, and maybe you have noticed as well, there's a lot of health insurance brokers that enroll a company and then they don't do much. So I'm available. You can call me or text me. I'll always answer. And if I don't answer, I'll get back to you as soon as possible. And there's tax credits. Now, on an individual, that we call them advanced premium tax credits. That means when we estimate your annual income, depending on where you are on the level, and I'm going to show some displays of that to make it more visual, because it can be kind of complicated. There will be advanced premium tax credits if you fall in a certain income category over the poverty level. So up to 400% over the national poverty level, you can qualify for some advanced premium tax credits. What that means to you is it brings down your monthly premium. Now, in regards to a company, there are tax credits as well. So you have up to 2 years. This is a different deal. I will get into more details on another video. Right now, I'm just giving kind of a 101 Healthcare Affordable Care Act, California style. Moving on. So like I said, the premiums are based upon your income, and that's an estimated annual income. Copays that are not a deterrent to care. So copays, that's a whole other animal. Zero deductible for many plans, free preventative care, lower out-of-pocket maximums. So what they've also done is they've capped the out-of-pocket maximum on a healthcare, on an individual or a family plan. They used to, you would hear about people having these high deductibles, and they say to them, you know, you'll hear the complaint of, well, when I'm paying all this out of pocket, when does my health insurance actually kick in? So that number has been lowered, actually capped, so you don't have to worry about exhausting all your money out of your pocket and thinking to yourself, well, when is the health insurance going to start? So right now you've got around Sacramento County, San Francisco County, Los Angeles County, and San Diego County. You got different players, health insurance companies. For example, Sacramento, you got Anthem, Blue Shield, Kaiser Permanente, Western Health Advantage. San Francisco County, you've got Anthem, Blue Shield, Chinese Community Health Plan, HealthNet, and Kaiser Permanente. In LA County, you've got Anthem, Blue Shield, HealthNet, Kaiser Permanente, LA Care Health Plan, and Molina Healthcare. Now, you also in San Diego, Anthem, Blue Shield, HealthNet, Kaiser Permanente, Molina Healthcare, and Sharp Health Plan. I can go over these in more detail on an individual basis if you need more info. That is in regards to Medi-Cal. Now, on the public and private health insurance companies, the health insurance plans are offered from Anthem Blue Cross of California, Blue Shield of California, Chinese Community Health Plan, Contra Costa Health Plan, Health Net, Kaiser Permanente, LA Care Health Plan, Malina Healthcare, Sharp Health Plan, Valley Health Plan, Western Health Advantage. Dental, we can offer dental health insurance as well. So dental, basically some of those same providers. If you need dental, just let me know. It's customary for some of these health insurance companies to be involved in health and dental insurance as well. So you just let me know if you're interested in that. Most likely you are. So moving on, we've got, this is how it works. For Medi-Cal, number of people in your household, that's a determining factor. 1 to 5 people is what we'll talk about. Now, if you're a household of 1, then you qualify for Medi-Cal if your estimated annual income is $0 to $15,856. So that's, let's call it 16 grand. 0 to 16,000 in your household of 1, then you do qualify for Medi-Cal. Now, if you're a household of 2, that number goes from $0 all the way up to $21,400. If you have a household of 3, $0 to $26,000. $26,951. Let's call it 27. So 0 to 27,000. Now, if you have 4 people in your home, $0 to $32,000 and $499. 32 and a half. So again, 4 people, household of 4, $0 to $32,000. 5, household of 5 will mean $0 to $38,000. Okay, so that's all for Medi-Cal. Now, for premium assistance, which is the advanced premium tax credits, in your household of 1, that means if you're at $15,856 to $45,000 estimated annual income, then you do qualify to buy a health plan on the health exchange. So basically, if you're a household of 1 and you're around, let's call it 16,000 for easier, 16,000 to 45,000, household of 1, you will qualify for advanced premium tax credits, which means a credit each month instantly that makes your monthly premium cheaper. That's where this whole Affordable Care Act makes it more affordable for an individual that only makes $16,000 to $45,000. They give you a tax break. It's an immediate tax break. So you have cheaper health insurance monthly premium. If you're a household of 2, then you can make $21,000 all the way up to $62,000 and still qualify for some some advanced premium tax credits. If you're a household of 3, you're going to go $26,951, let's call that $27,000, all the way up to $78,000. Now, if you're a household of 4, it's going to be $32,000 to $94,000. You're in that bracket, you get advanced premium tax credits, you get a little bit discount on that monthly premium. Now, if you have a household of 5, you can make anywhere from $38,000 up to $110,000 and still qualify. Now, obviously, it's a sliding scale, so the higher you are on that income, the lower that advanced premium tax credit's going to be. Moving on. The way it works, the way these health plans work, on the individual, on the actual exchange, mind you, you have to make a certain amount of money in order to qualify to purchase on the exchange, because if you don't make enough, then you automatically qualify for Medi-Cal. So basically, on the health exchange, you got the metal plans. Metals as in bronze, silver, gold, and platinum. So basically, you can look at this like the bronze. The health plan is going to pay about 60% of your health costs. The consumer will pay around 40%. So on a silver plan, you got 70% the health insurance company is going to pay, and you're going to pay 30%. Moving on to the gold, they're going to pay 80%, you're going to pay 20%. The platinum, they're going to pay 90%, you're going to pay 10%. Obviously, this is only up to the cap, because they do cap how much out-of-pocket money you're going to pay. That's how it boils down, though. It's a metal plan, 4 different metals. You pick one. Now, moving on. I'll say this now. The silver is where you get enhanced coverages. So that's a real sweet spot. That's where you get more bang for your buck if your income isn't at a very high level. I'll get into that later. So, moving on, I'm not going to go into all these health details. We're already at 20 minutes, and I'm just going over some basics just to try to clear up any fog you might have on what exactly the Affordable Care Act is. Moving on. So, maximum out of pocket for an individual, $6,350. Pretty simple. You're only going to pay out of your pocket $6,350 for the year, in case something, catastrophic happens, or if you got a lot of prescription medications. I mean, so much that in your plan only covers, that's a separate limit, but out of pocket across the board, $6,350. Sliding scale benefits, that's what we're talking about. Moving on. How are your rates determined? How do they figure out how much to charge you each month? That's based upon your age, and it's based upon your zip code, and it's based upon how many people are in your house, your household, and it's based upon your estimated annual income. And also the health plan, metal plan, which one are you going to get? Bronze, silver, gold, or platinum? That is how your health premium is going to be determined. Now, again, this is some of the new things about the Affordable Care Act. They're not going to base it upon your health status. They're not going to base it upon gender, if you're male or female. And they're not going to base it upon pre-existing conditions. And tobacco use. They're not going to charge you any difference if you use tobacco or if you do not. So, let's say you've already enrolled in Covered California, and you're wondering how to choose me as your broker. It's easy. I'm going to show you exactly. You just log in. You log into your profile. Now, if you did make your own profile, you just log in, you say designate, or you click on help near me, and then you type in my last name. It's Whitlow, W-H-I-T-L-O-W, or even my first name, Zachary, Z-A-C-K-R-I. I'm the only one out there in California. So you can find me in the designate. Well, you designate me as your agent, and then it'll come to me. You call me, text me, and I'll be there for you. You can call me, text me, email me anytime, and you do not have to deal with those 1-800 numbers anymore. That's one thing my clients like a lot, is they can contact me when they have a question. They never have to wait on those long holding lines, and they can be lengthy if you don't have an agent. The other benefit to use me is you don't have to pay me any extra money at all. I've been in insurance for over 12 years. Come from an insurance family, so I'm pretty geeky when it comes to insurance. But the nice thing is you can designate me as your agent, and I'll help you. And it's no cost difference, because if you don't use me and you just stick without an agent, then the health insurance company is going to keep that commission. They're not going to charge you any different. But if you designate me, then what happens? They'll just pay me, no difference to you. So, like I said, $0 difference to use me as your agent, to designate me. I'm here to help. You just let me know. I can answer questions. My phone number is 310-462-2479. My email is zach@whitlowins.com, Z-A-C-K, at Whitlow, that's W-H-I-T-L-O-W, INS.com. I'm available pretty much anytime. I am a full service broker, so I do, personal lines insurance, commercial lines insurance, risk management services for companies, small, medium, large. Thank you for watching this. Hopefully you learned something. I know insurance is not the most fun thing to talk about, but maybe you can watch it and help you go to sleep at night. Thanks, and hope you're having a great day. Bye-bye.